Welcome to Doc Secret, the show where we uncover the playbooks, strategies, and stories behind the most successful dental and medical practice owners and the companies that serve them. This show is all about building the best practice. Whether you're a dental or medical student dreaming of private practice, a seasoned doctor looking to grow or sell, or an investor exploring the healthcare space, this podcast is for you. I'm your host, Kevin Carl, and in today's episode, we're diving into the biggest challenges facing specialty practices today. Let's get started. Joining me today is Dr. Sarika Shah, Clinical Director of Platinum Dental Care in the heart of Canary Wharf in London, and importantly, a leader and coach making a difference in the lives of women. Dr. Shah, Sarika, if you will, welcome to the program.
Thank you so much, Kevin. It's such a pleasure to be here today.
Well, Sarika, let's begin with your journey. What brought you to dentistry, and how did your upbringing shape your approach to the profession?
Well, it's very interesting because I am a fourth generation Indian born in East Africa. So many years ago, my family, they were traders. They came to East Africa. They then started to set up small businesses. And so a lot of my family have an entrepreneurial or a business background. And so that's what I was destined to do. And I initially applied for a business related degree in university. And then at the very last minute, there were a few conversations that happened and I changed my mind and I decided to choose dentistry. I remember having a conversation with my mother. She's very artistic. So I built, those strengths growing up, through her. And then my father, again, coming from a very entrepreneurial background, he loved the sciences. So I picked up a lot of the sciences and the business background. And then I happened to just do a bit of work shadowing with a few professionals on the high street, very close to where my school was. And I met the local dentist and I had a very interesting conversation with him. And he said to me, this is just an incredible profession because if you love science, it's all science-based, it's very artistic. And if you ever want to in the future, you can open your own practice and then you're able to run a business. And I thought, this is brilliant. I can now bring everything together, all those elements. And I think this career is for me. And I've never looked back, I guess. And that's what took me to dentistry.
Wow, that's great. And I know in 2017, you bought a dental clinic and turned it into a fully digital practice.
Yeah.
Interesting. We'll talk about that. What was your vision at that moment that you bought the practice, and what were the biggest challenges early on?
So I think when we bought the practice in Canary Wharf, we were surrounded by other dental practices that were corporate owned. So we were one of the few independent private practices in Canary Wharf. I always had this vision that whenever I bought a practice, I wanted it to be really different. I wanted it to look and feel different. I wanted it to smell different. I wanted to give my patients a completely unique experience that they hadn't experienced before. And in a sense, I wanted to be really authentic. And that's what I did. We were really privileged that the practice is located in one of the last standing docks in Canary Wharf. So there's a lot of exposed woodwork and brickwork. And I guess being, so outdoorsy in my childhood in Kenya, I was kind of drawn to that. And then slowly, over the years, we started to build the practice up, started to build our brand. We went through 2 refurbishments to make it look and feel like how I wanted it to. And yeah, I'm just so proud of where my clinic is today.
That's exciting. Well, I know you said we in your statements there.
Yes.
And I understand your husband is a partner with you in how you're approaching your practice. How do you and your husband divide up leadership responsibilities? And, what's it been like building this together?
So my husband has a banking background. And again, he was going through lots of transitions in his career. And I had this big, beautiful vision of what I wanted my practice to be like. But obviously, as dentists, we come with very little business knowledge. And so when we were looking for a clinic and setting up the clinic, he was very interested. He was giving lots of advice. And then one day we just decided that, look, what about if we did this together? Because we have, very individuals, separate skill sets that we could bring together and, make this into a really successful business. And that's exactly what we did. It's brilliant because he brings his elements and his skill sets into the business, and I bring all the clinical aspects and the people management and the leadership style into the business as well. So together, I guess we're a perfect match, and we really enjoy it. We love working together. Um, so yeah, it's been absolutely fantastic. And going back to your question about challenges, lots of challenges. I think some of the biggest challenges that we faced earlier on was building our team and getting the right people on board, based on our values and the type of culture that we wanted to create. Because, the shell and the aesthetics was one aspect, and the service we wanted to provide was another aspect. But of course, when it comes to the team, the mindset, the values, and the culture is just as important when it comes to, leading a successful business.
Okay, so how did you create a vision and then articulate that to your team to pull people in? Did you have meetings? Did you set that through policy? Share with us a little bit about how you built culture in your practice.
Yeah. I think it comes down to honesty and building trust. And that's the basis of relationship building. And that's exactly what I do right from the onset, right at interview stage when I'm interviewing for staff members. I'm talking about my vision and my goals and the type of culture that I want, but also some of my non-negotiables. I'm quite honest with them, that there are some things that just won't stand, and I just want to have a certain culture that if they became a part of and they contributed to, that they were going to have just as much fulfillment, passion, for their own careers and growth in their own careers as well. So again, I'm very honest. I think trust is the basis of any relationship that you want to build, and any relationship that you want to last as well in any business. So I think that's really important.
Well, brilliant, brilliant. Thank you for sharing that. You know, I know these challenges that you spoke of, for every dentist, for every entrepreneur, they're different, right? So let's take a step back and look in a broader view. And in your view, what are the top three challenges facing dental specialty practices right now, especially in competitive urban markets like London?
Yeah. So look, I think that, I mean, I can speak from being in the UK that, we went through Brexit and then we had COVID. And so there was lots of socioeconomic changes that happened in the country. We went through, and I think we are still going through a little bit of a recruitment crisis where a lot of our nursing staff and administrative staff um, pretty much left the country. And then it was really difficult to recruit talented members onto the team. So that was the first big challenge that I think that we went through. I think secondly as well is that I think expectations from the workforce have changed as well. It's having to adapt to what people want, in their careers, how they want to grow, what is the environment that they want to work in, what is it that they really value. And I think that was a big eye opener. And so one of the things that I also include in my recruitment process is I'm really open about what my values are as a leader, what the team values are of the business, and try to see if, they're aligned with the other person's values as well. So that's really important. Um, so I think that's one big change that we've had to adapt to, is that people's expectations in the workforce have also changed. And I think the third thing is that dentistry as a whole is transitioning on so many levels in so many realms. It's really transitioned. Especially in the UK, there's a lot more practices that are moving away from the National Health Service, the NHS, into more kind of private independent practices. So there's been a big growth in that area of independent private practices. Um, and I also think that technology has played a big part as well in the way practices have transitioned. So we've really had to get on board with being a technologically advanced clinic. So yeah, they've been all the challenges that I think we faced. But challenges aren't ever a bad thing. I think they're always a good thing because it just makes you think about how you're going to grow and move forward. And that's my approach to it anyway.
That's great. So against that backdrop of change, how do you think technology and patient expectations are reshaping the way that practices have to operate?
When it comes to people, okay, when it comes to patients, when it comes to the individuals working the clinic, so let's say the workforce, I think people value different things today. So I think they value transparency, they value inclusion, and they value empowerment, or self-empowerment. And I think I always have that at the back of my mind when it comes to my patients. So I think technology has placed, has played such a big part in that, because it's allowed us to plan our treatments in a way that we can educate our patients so much better using technology. We can plan all our treatments digitally, and much quicker, because especially in Canary Wharf, I have patients that are really time poor. They want things done really efficiently. They want to be informed about everything, and they respect honesty and transparency as well. They want to be able to make informed decisions. So I think that has been the main thing. Technology has really allowed us to communicate a lot more effectively with our patients and our team members as well. So I think technology's just played a huge part and almost revolutionized the way we are practicing dentistry today.
Well, and you've got a technologically advanced clientele there in Canary Wharf, as I remember from my days in London. So, from a clinical and business perspective, what have you seen change the most in the past 5 years? Maybe let's say, right at COVID, COVID timeframe, that was sort of a cataclysmic change, right? Big change for the industry. And take us through, let's say, COVID, post COVID to now. What are the biggest challenges and changes that you've seen in that time period?
So I think when it comes to technology, and COVID, I think was a big turnaround, especially for me. I took a lot of my consultations online. So there are some consultations that you still have to do clinically, but there are a lot of patients that want to know about treatments. They just want information. So those appointments got taken out of my diary, which meant then I had a lot more clinical time in my diary to fill up with other patients and more clinical work. So in that sense, it made it a lot more efficient. And even today, I take a lot of consultations online and remotely when I'm not in the clinic. So I think from a business side of things and in terms of growth, I think that was a big game changer. Um, Also, I think technology's played a huge part in the administrative side of things. So the way we take our calls, how we deal with leads, and we have an AI technology that is able to really kind of organize all our leads as well in a really efficient manner. Also, the software systems that we use, there's a lot of AI technology in that as well, which has made it really productive and a lot more efficient on the administrative side on my team as well. Clinically, gosh, so many changes. We have had, scanners for full mouth intraoral scanners, which have just been a fantastic tool. I think I was an early adopter of that, and I'm so glad I was. I've never looked back. And it's fantastic in the sense of diagnosis. We can look at all sorts of things that, the scanners I have also have infrared technology to detect tooth decay. We can detect how the patient's bite is, gum recession, tooth wear. We can then show the patient their scan in 3D. So it's a fantastic tool to educate our patients. And start to get them a little bit more invested in their oral health as well. When it comes to x-rays and radiographs, we now run all our x-rays through an AI technology as well, so it can detect tooth decay, bone loss, and also pathologies with incredible accuracy. And so it also reduces diagnostic variability as well, which was one of the biggest issues with x-rays. And then when it comes to treatment planning, again, a lot of, especially the orthodontic side, which is a special interest of mine, we're doing all our orthodontic treatments digitally, beforehand. We can also we use a lot of digital smile design, and to the point where now we can integrate that into the patient's face, and not just statically, but in movement as well. So AI has played, such a big role, and it's only going to get better. It's only going to grow, I think, which is really exciting.
Yeah, what a different experience from my own childhood and that of my kids, right, who are now in
Yeah.
their 20s. That's just an amazing evolution of capability. And it sounds like a fantastic way to use technology to gain insight, help patients. Amazing.
Do you know what it's also done on the business side of things is that I it's standardized care in a sense as well, which I think is really important especially in my clinic, when we work at such a high standard and we're trying to provide optimal care to our patients, that it's really important that all clinicians that are coming in with all their different skill sets can provide a high level of standardized care. And I think that's the big difference as well. And on a business perspective and a clinical perspective together, that's made a huge difference.
Sarika, do you think that there's a widening gap? And I mean, you've got a high level of care, and then you've got, let's say, maybe the competition doesn't have this sophistication, and then, you've got the National Health Service. Do you think that there's a widening in the capability set and therefore the standards of care in the UK?
Um, yes and no. I think that we have two bodies that we're governed by in the UK. The first is the General Dental Council, and the second is the CQC, which is the Care Quality Commission, and they're national bodies. So in a sense, the clinical care, in a sense, is standardized. There's a certain standard that we have to meet, and we have to do a certain level, especially our GDC requirement. The General Dental Council requires that we do a certain amount of CPD every single year as well. So every dental clinician is expected to do that. So I think in that sense, care is quite at a high level and is quite standardized as well. Um, I think that when it comes to dental practices, I think like any business, uh, you know, I think there's always going to be a variance. There always will be. And, the National Health Service is, limited to the type of care that can be provided, within the NHS. Whereas with private dentistry, we have the flexibility to provide all types of care. And I think that's the main difference between the NHS and private dentistry. So I think there always will be some degree of variance, but I think in general, from what my understanding in the profession, that everyone, I think, wants to provide a high level of care, and the culture of providing high level of dentistry is really there in the UK.
That's great to hear. Well, you've coined the phrase lead with digital dentistry. What does that mean in practice?
For me, it means that ensure that digital dentistry is at the forefront of our minds, and really use that as a tool for everything that we do within the clinic. So, like I mentioned, leading with digital dentistry when it comes to the administrative business side of things just means that operations are going to be a lot more streamlined. There is less workload for admin teams, and members on the team aren't burning out, and they're able to manage their time a lot more efficiently. When it comes to um, patients and patient care, it just means that we have faster, more accurate diagnosis when we can use all of these tools. It means that there are reduced risk of missed conditions as well. We can accurately diagnose conditions and pick things up a lot more accurately. And like I said before, that we've got just more consistent care across all the clinicians. So this is what I love is standardization, a high level of efficient productivity and standardization. And that's how I really want to lead my team when it comes to technology. I also think that I was an early adopter of some of the scanning technology. It was the first thing that I bought in my practice, and I literally had to beg my banker husband and say to him, please, can we invest in this technology? I promise you it's going to be amazing. And I wanted to buy all the best stuff, and so he said, you're going to have to choose. And I said, right, I choose this. And I've never looked back. It's just really led to immense amount of growth. It's changed the way we're doing dentistry. It's changed our patient experience. So and look at the world now. It's where it's all technology. And if we're not riding that wave, then we're going to be left behind.
Yeah, well, speaking of waves, everybody's talking about AI. You've mentioned AI in your comments just now. How has AI transformed how your team delivers multidisciplinary care? Could you walk us through maybe some specific tools or workflows, patient scanning, AI driven diagnostics, or call management, those kinds of things that have elevated efficiency in your practice?
And it was, it's pretty much everything that I'd mentioned before. But in terms of multidisciplinary care, I think that the first thing is my team is multidisciplinary. So we're a multidisciplinary clinic, and so that means that we have a lot of general dentists that are qualified to a very high level of restorative dentistry. But each dentist has a special interest in a niche. Okay, and then we also have specialists in the practice. So we have a specialist endodontist, we have a specialist oral surgeon, we have an implant dentist, and we have a prosthodontist. And I have a special interest in orthodontics. So sometimes there are cases that require all of us to come together to start planning the case and then executing that treatment clinically as well. And so the great thing is that it starts off by just some digital photographs. It can start off by taking some videos to see how the patient's soft tissues, their lips, and everything is moving, and then a full intraoral scan, sometimes X-rays or radiographs as well. And then the great thing is that we now have a platform where we can now upload everything on there, and then all of us can remotely look into it, contribute, leave our comments. We can all have a meeting on there. We can discuss the treatment planning for that patient, and then come up with something that's going to be in the patient's best interest long term, and be able to provide, a treatment that's going to be then optimal, but also stable for them long term. And then also plan how that treatment's going to be carried out and by whom at what stage. So, it's just fantastic how it's just completely transformed how we're planning cases now. Whereas before, we would have to talk to each individual, maybe have a call together, maybe have a Zoom call together, like bring everything up, arrange a time when we're all super busy. And so this has just made things so much easier when it comes to multidisciplinary patient care.
That that's such a big change that's taking place in practices like yours. With so many people coming together, how do you train or onboard your staff to be comfortable with this level of technology integration?
So I think it's always starts with going back to the vision and the mission of the practice. It's not something I just talk about once. It's something I talk about all the time, every day. What is my vision? What are my goals? And in a sense, it's about motivating the team consistently in different ways, to get them on board with the path that I want to be on and the growth that I want to be on. Remember, it starts with the recruitment process. So I really only want to recruit the right members of the team that are aligned with my vision and my values and the culture and my goals and where I want to take the practice to. When it comes to training, because technology is changing so quickly, it just means regular meetings, regular training days, touching base with everyone because everyone learns differently as well. So some people might take a bit more training than others. And it's also kind of leveraging other people's skills off each other and, using teamwork so that they're almost, motivating each other and teaching each other, and elevating each other um, when it comes to learning, and staying consistent with that learning as well. So yes, I think it's just staying on the right path and just being consistent, offering support, which I think is really important. I think as a leader, just always I have a lot of one-on-ones with members of my team. We have lots of team meetings, we have group meetings, and I love it. That's the part of my job that I absolutely love. I think being a principal and a leader. So it's just constantly touching base, offering support wherever it's needed, being compassionate, in the team as well, and really recognizing strengths, and leveraging on those strengths for each individual as well.
Sarika, you've thrown out a lot of weighty words there that I think are really important: training, elevating, leading. And I know you've taken a very public role in leading women in dentistry and outside the profession as well. You're not only a practice owner, but you're also a mindset coach. Why do you believe leadership starts within?
Well, I'm a strong believer that it's very difficult to lead other people if you can't lead yourself first. And I went on the self leadership journey a long, long time ago, almost 12 or 13 years ago. I was almost forced into it, or I kind of like just dove into it straight away because I hit burnout quite earlier on in my career. And then I actually went through 7 years of IVF treatment. So I had 14 rounds of IVF. And so I had to really look at mindset, emotional regulation, and how I can lead myself from within. Because as I was going through all these things, I was also setting up my practice, and trying to grow my practice at the same time. And so I went on this massive journey of trying to understand, learn, and master something called self leadership or personal leadership. Um, and I really found that that was the way that I was able to really start to control my thoughts, my emotions, and my actions, and be able to set goals very intentionally. To always go in with a purpose. Whenever I had something that I'd set my mind on, is that why am I doing it? What's the why behind it? And really being in tuned with that as well. And then slowly, what I started to do was I started to teach members of my team, to become self leaders. And I started to teach them about self leadership because I wanted them to start making autonomous decisions. I didn't want to micromanage them. I wanted to free up a bit of my time as well, to be able to do other things and contribute to the business in other ways. And I wanted them to have, responsibility that they could just take on their own. So autonomy, to make decisions. So, and started to find that that was working really well, that they felt like having ownership, of their tasks, and me not being there over their head to micromanage them. And that there was a level of trust for them to carry that out. I think made a really big difference, in the clinic. And then, I climbed Kilimanjaro in 2023, And they always say that that mountain has special powers. And so I had really bad altitude sickness for the last 2 or 3 days going up. And so I almost did like a silent climb for 3 days, almost like a silent meditation. And part of me, there's this part of me that was like looking for a newfound purpose, that I have the clinic, I have a nice relationship, I've got a nice team, I now have a beautiful 4-year-old boy. And so really a part of me was niggling saying, what's next? And when it comes to that next thing, um, it's got to be something impactful. I want to create impact in the world somehow, but I didn't know what it was. And so 3 days of climbing the mountain silently, on my way down, something clicked and I said, right, I know what I need to do is, I really want to teach self-leadership and leadership skills to women in dentistry. And I realized there's very few, courses and education around leadership, and leadership, especially self-leadership, is so important in today's in healthcare in general, not just in dentistry, because we're dealing with people, like I said, that want self-empowerment, that want transparency, and we have to be able to regulate their emotions too. So there's a lot of psychology and communication that is involved in our non-clinical dentistry aspect of it. So I decided that I was going to set up a brand called Flourish as a Female in dentistry. And I within 6 months, I set up a 2-day course, in-person course for women in dentistry, very small, around 8 to 10 women, because I want them to show up their vulnerability. I'm a mindset and performance coach as well. So a lot of the course involves talking about mindset and beliefs, but getting women to understand what their mindset and what their beliefs are, and then being able to coach them through that, and through some of the self-leadership pillars and tools and strategies as well. So yeah, this is what I wanted to do, and really kind of create an impact to empower women to really strongly lead themselves from within, and then go out there and lead others and build practices and build businesses and really thrive and be successful in their lives in every aspect, not just professionally, but personally as well.
That's fantastic. I mean, first of all, thank you for your vulnerability and sharing your own journey. It comes to mind that many women in dentistry face career disruptions due to, biological or societal expectations. How do you advise women to reclaim their agency in those moments?
Well, I'll tell you what, Kevin, is that when it comes for women, I think what happens is that there's always a clash between biology and career, especially for those women that then choose to have children or choose to have a family. Remember, that's a choice. It's great that it has become a choice and not a norm for women now. So when they do choose to have children, it's sometimes at the time when they're really progressing in their careers. And I think something that isn't talked about enough is the fact that after we've had a baby, and we are very career orientated before we had the baby, we almost lose our identity, because there's huge psychological, emotional, physical changes that are happening in our body, and our body and our minds are literally telling us the only thing that's important now is the survival of this child. So we completely lose our identity in a sense. And so what happens for a lot of women is they kind of lose their mojo around their careers. They feel like they've de-skilled on the time that they've been off on maternity leave, and they find it really hard to sometimes go back to the role in the same kind of intensity as well, that they had previous to having a child. So I really take that seriously. And so when it comes to my team, for example, and I have a mostly female team, and I've got 3 members of staff going on maternity leave very soon, and I really think it's important to just talk about it, openly, and also then logically make a plan. Make them understand the implications that their time off will have over the business, but also about what are their plans, what is it they want to do, coming back. And sometimes you have to leave that open and leave space for that as well, for after they want to come back, because things change. They might think differently or feel differently. So again, I think being a compassionate leader as part of my leadership, I think is really important to me. Yeah, and just kind of being open and honest about that as well, because I've been through it, and so I know what other women are going through, and I just want to, I want to bring that out a little bit more, and I want other people to recognize that this is an issue, but there are ways around it, that we can kind of plan and then encourage women to get back to work should they wish to do that, and grow in their careers and thrive again.
Yeah, that's great. And I appreciate that it is very complex. As the father of two daughters who have their own aspirations and have often shared with me some of their thoughts about the future, what advice would you give to a female dental student thinking about opening her own practice one day?
Do you know what? I would strongly encourage them. I would strongly encourage. I think we need more female business owners and practice owners in the profession. Um, it, in my experience, it's also not easy because we don't come with the full business set of skills. We come with a very focused clinical mind, and I think that's the difficult part of it. Is there is a lot of people skills that you need, a lot of people management that you need, and there's a lot of business skills that you need as well. But the great thing is there are so many other organizations, and I think you call them DSOs in the US, which are basically non-clinical organizations that offer support. And again, earlier on in my career, there was very little of this, but there's more and more organizations now that offer support in all realms around the dental business, and you can use them, and you can really, I think, build a business, a successful business, and thrive. But yes, it is about really, you know, growing your leadership skills and making sure you're not only focused on your clinical skills, because like I say, today's workforce has changed, patients' expectations have changed. And so you have to be on board with that as well, understand it. And you have to do just as much leadership and communication and self-leadership training as you do clinically. I think it's just as important, whether you're a practice owner or not. I think even if you're an associate working in a practice, it's just as important.
Yeah, Sarika, you mentioned DSOs and you mentioned the support network. I'm really hoping you can provide some global perspective on the dental services market and the future of practice ownership. You've built a prominent clinic in the heart of one of the world's most global and dynamic cities. What do you see as key differences between the UK and the US dental markets?
I think the first thing is that in the UK, we have the National Health Service. So for many, many years, we've had the National Health Service, whereas in the US, it was mostly dentistry was mostly privatized. It was private clinics. It has changed in the UK, I'd say, over the last 10 years. There is more growth in the private sector. But there's still the NHS aspect of it as well. Um, I think historically what's happened is that because dentistry in the US has been private, um, that dentists in the US have been able to earn a lot more than dentists in the UK. But again, that's slowly transitioning as well. When it comes to practice ownership, I think again it's embraced in the US that it's almost that's the norm, that you go into dentistry, and you can either work for someone or at some point you own a clinic. Whereas in the UK, it's mostly been about working in the NHS or working for a clinic. But I think the mindset of a lot of dentists is changing. And I think that a lot of dentists do want to own their own businesses. What that's meant is that there is a lot more competition now in the markets. And so, again, it's just about adapting to that competition and being able to survive as a business. Not only that, we're seeing the growth of a lot of corporates in the UK as well. I'm not sure what it's like in the US. I'm quite sure it's very similar as well.
Very
But
much, yeah.
yeah, but we have dental corporates that are buying all these independent practices, and so I'm not sure if independent practices will survive in the future. I don't know what it's going to look like. So I think that that's a really big change that I can see as well, and the differences between the US and the dental market. Um, if I may add, when it comes to clinical dentistry, I think because we've had the National Health Service for a long time, there was a lot less focus on aesthetic dentistry. And whereas I think in the US, they've been, at the forefront of aesthetic dentistry for a long time. And I think that in the UK, where it's now becoming a trend, and it's a sector that's now growing.
And do you think that the sector is heavily influenced by DSOs and now private equity? Is that happening in the UK as well? Private equity getting into this space?
Yeah, absolutely. Absolutely. And that's where the dental corporates, I think, are growing. So that's definitely happening. And I think with DSOs, yes, I think that in the UK, especially when it comes to marketing, as an example, we are quite heavily regulated. I think there's less regulation in the US. And I think marketing can be a bit more aggressive, but we are very, very heavily regulated in the UK as well. So there are these key differences. I think when it comes to DSOs, like I said, there are a lot more business consultants, consultancy firms that are out there to lend support to dental practices as well. To also consult practices on how they can run more efficient and productive practices, and therefore more profitable practices as well. So for inexperienced dental practice owners, I do think that the help is there. It's about then, if the choice about investing in that help earlier on. And yeah, and then I think that's really a choice.
So you mentioned regulation as it relates to marketing, and I'd love to understand that better from a UK perspective. How does that regulation impact what you can say or do from a marketing perspective?
Yeah, I don't know deep details into the regulation of marketing, but I do know, especially with what we've been trying to do with the practice, that we definitely, when it comes to facial aesthetics, we've got to be really careful on how we word facial aesthetics ads and marketing around that as well. Everything has to really have a clinical outcome, or something that is to do with the patient's, treatment that we're doing for the patient's best interest. And so I think when it comes to aesthetics, I think that we still need a bit more regulation, national regulation when it comes to that. Definitely. And I think when it comes to marketing, to be fair, I think that the regulation we have at the moment is fair. I think it is correct not to overly market certain treatments, and that we should really have the patient's best interests at heart when it comes to their healthcare. I think that's really important, and so I kind of stand by that, if you know what I mean.
Sort of sounds like an intent to focus on health outcomes versus, say, a vanity focus, if I may.
Yeah, absolutely. Because I think a lot of things can go wrong if you're marketing in an incorrect way, you know?
Yeah, I think we in the US could probably learn a little bit from you all on that. Well, how can dentists in any part of the world start thinking more like practice CEOs than clinicians? I recognize the patient centric care is important. It's the heart of what you do, but you've talked a lot about building a practice. How could practitioners globally start to think more like a CEO, maybe than, just focused on the clinical dentistry itself?
Do you know, one of the things I talk a lot about is that I think every person working in the clinic should think of themselves as their own business. So they should, on a very basic level, have goals that they've set for themselves within the framework of the main business itself. And there has to be an alignment of the values and the vision as well. But they should really set their own goals, whether it's growth clinically, educationally, financially, whatever that is. And they should really think of themselves as their own business. But when it comes to your own business, leadership plays a really big part in it. And that's why I'm a strong believer that you have to start being able to lead yourself first. And then what's happening is then you're then able to lead other people. When it comes to dental clinicians, that's really important because they're always working with micro teams. They're definitely working with dental nurses. They are working with someone on the front of house team. They're working with patients. That I include patients as part of our team sometimes because we're communicating, with everyone in those micro teams. And so there has to be some level of management skills, managerial skills, time management skills, and leadership skills. And then, of course, you take that a step further, and those individuals have to be able to start being able to communicate with other dental clinicians. They have to be able to then communicate effectively with the practice lead or the practice principal. And sometimes we're also communicating with companies outside of the clinic. When it comes to purchasing equipment and staying on top of new technologies and learning and going on courses. So I think that as soon as you start thinking of yourself as your own business, you're able to set clear goals. And then be able to grow and push forward. And when every individual is growing in the practice, the whole clinic is growing. The whole practice is growing. So then everyone benefits. And when we're really aligned with our vision, our values, the overall goals of the practice, like you said, patient-centered care, and providing optimal care, working productively and efficiently, then inevitably everyone succeeds in that bubble.
Yeah, it's a magnifier effect, right? That sounds great. And by the way, that is fantastic advice for anyone, not just in dentistry, but for any profession. Very fitting. Well, thank you for that. And Sarika, we always wrap up our show here on Doc Secret with the lightning round. So these are quick answers, whatever comes to mind first. All right, let's go. Again, quick answers, whatever comes to mind first. What is one piece of technology every dental practice will be using in 5 years?
I think dental scanners, format scanners.
Got it. What is one book that has changed how you lead?
Got it right here. Leaders Eat Last by Simon Sinek. It's always on my desk.
Fantastic. One mistake that you made early in your journey that you learned the most from?
I think when change happens, I was quite reactive. And I've decided that it's really important to step back, breathe, and go move forward with clarity. And so I realized change is inevitable. It's part of growth. So embrace it and don't be fearful of it.
Great advice. What is one thing patients often misunderstand about dentists?
Ooh, I think that patients often think that we're just there to, in a sense, drill and fill. But really, I think dentistry is healthcare because we're not just looking at the mouths, we're looking at the patient as a whole. It's a lot to do with psychology and emotional regulation. And I also think it's got a huge, like a lot to do with entrepreneurship as well, all wrapped up in one.
That's great. Thanks. And this might be hard given your depth in leadership here, but what is one word that defines how you lead your team?
Ooh, tough one. I would say intentionality. Intentionally, always leading is the one I'm going to go for.
Brilliant. Brilliant answers. Thank you, Dr. Sarika Shah. Thank you
You're
for sharing
welcome.
your insights with us on this episode of Doc Secret. It has been wonderful to have you on the program. Thank you so much.
It's been such a pleasure, Kevin. Thank you so much for having me. Thank you. I've thoroughly enjoyed it. Thank you.
Thank you. If you liked today's episode, please like and subscribe, and most importantly, share this podcast with others you think may benefit from the Doc Secrets shared here today. Thanks for joining us on today's episode, and we'll see you next time.